You're listening to the Good Question Podcast with Richard Jacobs. Our goal is to make each of our guests exclaim, that's a good question. I don't know the answer. Because when that happens, it means you, the listener, may be inspired to learn more beyond the interview and to ask great questions yourself that lead to new insights. In this podcast, we cover historical and current anthropology, comparative religion, and history. Welcome, and let's get started.
Hello, this is Richard Jacobs with the Good Question Podcast. My guest today is Dr. Stephen Hussey. He's a functional medicine doctor. He wrote a book called Understanding the Heart. So we're going to talk about the science of the heart and metabolism and what's called light and structured water that affects your health. So thanks for coming, Steve. How you doing?
Pretty good. Thanks for having me.
Yeah. Well, it's on your bio. I guess you suffered a heart attack at a very, very young age. I don't know if it's okay, but could you relate that story and what happened from there?
Definitely. Yeah. Yeah. I mean, going way back, my life has always kind of been concerned with health. I had a lot of chronic health conditions as a kid. And it wasn't until college that I found out that I could change the way I live my life, like behavioral lifestyle wise, and have a direct impact on my health and got rid of a lot of those conditions I had as a kid. So I've always been like very health conscious. So yeah, it was pretty interesting, that I never heard that from my doctors growing up, that you could change the way you live your life and have an effect on these conditions and get rid of a lot of them. But then also surprisingly, despite, living in the best way that I thought was healthy, as far as like a pretty clean whole foods diet and exercising regularly, at the age of 34, I had a widowmaker heart attack, which really sent me back to the drawing board. It sent me back to like, okay, well, what did I miss? And I've gotten, a formal education as a chiropractor and functional medicine. So I had this training in these alternative forms of medicine, yet this still happened to me. So it really forced me to go back to the drawing board. And what I found has kind of, I guess, revolutionized the way I saw health and physiology, because it's not what we've been taught. It's not, and from my perspective, it's not what we're taught in any sort of medical school. It's a very basic biochemistry understanding of things. So for me, I was pretty, after that heart attack, I was sitting in the hospital pretty demoralized and full of self-doubt, and had to kind of rally, because the experience I got in the hospital, I knew wasn't the best thing to do. They were prescribing lots of medications.
But you're young too, and I'm sure no one knows why. And every person was like, "Oh, you're so young," and also
nobody. When I ask them why, they just say, "Oh, your cholesterol. Cholesterol causes this," And I say, "Why so young?" And they didn't really have any answers. So yeah.
What about now? Do you have any answers after it's been a while?
Yeah, I think that.
Why, or you had to let that go?
No, I have. I don't think I'll ever know exactly why. No one could ever tell me that, because we don't have it happening, at the moment right now. So we couldn't really tell. And all of what Western medicine has as for causes of heart attacks are theories. There's no proof that any of them are true. They're just the generally accepted theories, like a plaque rupture or a slow, gradual blockage of an artery causing heart attacks are just theories based on observations that they see when they go and they look at arteries. So for me, I think that things that contributed, there's two different mechanisms of heart attacks, and my heart attack could have been either one of them. But things that contributed to my heart attack were, one, I was going through a period of higher stress, and I got some of the most stressful news of my life a day and a half before the heart attack. I was also kind of chronically dehydrated, and I was trying out a certain way of eating that ended up kind of dehydrating me, and I was picking up on signs of that and about to change things, but I hadn't changed things yet. So I think dehydration played a key role. And then I also did in that state where I was stressed and dehydrated, I also did a intense workout. I was trying to distract myself from the stress. On the Tuesday morning, I had the heart attack, and I did a very intense workout, and 20, 25 minutes later, boom, I had a heart attack. So I think those things were the contributing things, mechanisms of what those things did that caused the heart attack. We can get into if you want, but I think those were the main things that contributed.
So what did you do when you had it? They didn't know, they stuffed you full of pills and all that. I mean, what happened next?
Yeah, so like the care I got in the hospital was underwhelming from my perspective. All they wanted me on 5 medications the rest of my life, and it was not like an assessment of me and my general health. It was like, here's the cookie cutter recipe that people get when they have a heart attack, right? And so an illustration of that for me is, and I'm not saying that no one should take medications or not listen to their doctors. I'm just saying that it didn't make sense to me what they were doing. So like my blood pressure has always been fine, but the protocol after a heart attack is to take a blood pressure medication. And for me, they recommended 2. And I took one of them for one night. And I woke up in the middle of the night with very low blood pressure, and I got up to change the thermostat in the hospital room and almost passed out because my blood pressure was too low. Because again, they weren't looking at me, the person. They were looking at, here's the recipe for someone who gets a heart. This is the standard of care. If we don't do the standard of care, we're liable, right? So the food they recommended or they gave me in the hospital and the diet they recommend that I eat and just the overall approach to health after a heart attack was very disappointing to me from the doctors and the nurses and the nutritionists and the hospital. And so I decided not to do their recommendations or very few of their recommendations and went and did my own heart health routine or heart healing routine based off of what I previously knew and then what I also found out later, because like I said, I had to go back to the drawing board. And within 3 months, my heart had completely recovered and my ejection fraction and the tissue that was damaged in my heart had recovered. And I was also able to reverse plaque in my body over the next 2 years, which they told me was impossible. So I didn't know that the approach that I took was going to work when I started doing it, but it did work. And then when I found out why and potential mechanisms of how it worked, it kind of blew my mind. And so now I'm sharing that because I think there's a better approach to this condition.
Well, what did you figure out? What did you start studying? What was the first biggest breakthrough in what you were researching or reading about?
Well, the main thing is that, there's this whole theory that plaque in arteries and heart attacks is caused by cholesterol. And, Western medicine knows that there's other factors too, but the main theory is that it's cholesterol in your blood. However, there's really no evidence for that especially heart attacks. And so what you find though is you find that plaque in arteries is primarily clotting tissue. It's made up of fibrotic clotting tissue, which is the same type of tissue that if I cut my arm or something or cut my skin, scab forms. That's clotting tissue. So this is forming inside the artery wall. This clotting tissue. And so there's very little cholesterol present in this plaque. It's primarily this clotting. So why would the blood clot? That's what I had to figure out. And the reason is the blood would clot, because a heart attack can be caused by an acute clot that forms. It's instantaneous and it's so fast that the body can't adapt to that. And you get a lack of blood flow to an area and that causes heart tissue death. It can also be caused by a different mechanism that has to do with an imbalanced stress response signal to the heart, which could have been the case for me too because of what I was going through beforehand. But there are 2 different mechanisms of causing heart tissue death, which is what a heart attack is when heart tissue dies. And so I had to figure out what causes clotting. And what causes clotting, we've known this since 1856. Way back in 1856, this scientist named Rudolf Virchow told us that it's when we get blood that's too sticky or too viscous, when we get damage to the lining of the artery, or when we get stagnant blood flow. Those are the things that can predispose us to a clotting response in the blood. And so that means that if the artery is inflamed or if you have stagnant blood flow or blood that's like hypercoagulable or like going to clot too readily, then you're predisposed to that. And that was one thing that I had was dehydration, which definitely creates stagnant blood flow and this hypercoagulability, this increased ability of the blood to clot. And so when I looked into how you prevent those things, lots of people would say, oh, if you don't want the blood to clot, you take a blood thinner. You take aspirin, you take a pharmaceutical blood thinner. And yeah, that's a biochemical way to prevent clotting, but there's also a biophysics way to do it. And that's when we talk about structured water, which is a type of water that's in more like a gel state. But when you build structured water in your body, it actually keeps blood moving. It protects the lining of the artery and it keeps blood thin from a biophysics perspective. And the reason that this makes sense is because the number one thing that builds structured water in our bodies that causes water to become this gel state is infrared light. And the sun is 40 to 50% infrared light at all times, anytime the sun is up. And humans are the only species on the planet that live primarily indoors. So the statistics are the average human today spends about 93% of their times indoors or in an enclosed vehicle, away from the sun's infrared light. And every other species, trees, plants, bugs, all the mammals, they're outside in infrared light all day long. And we've divorced ourselves from that thing. And so if we don't get that, we don't keep blood structured water, we don't keep blood moving, we don't keep blood thin from a biophysics perspective, we get this increased risk of clotting. So that's the first, contributor, is that we've divorced ourselves from that. We've also introduced a lot of things that can create inflammation in the body. So this is electromagnetic fields, various toxin exposures, heavy metals, plastics, things like that. And then lastly, we've created an epidemic of type 2 diabetes or insulin resistance, which is the number one risk factor for heart disease because when you're insulin resistant, you impair wound healing. So if you get impaired wound healing, if you get a clotting response on an artery, that's that response to a wound, then you can't heal it and the plaque sticks around. So that's this kind of three-pronged approach to heart disease, and it makes sense and it tracks with what humans have done over the last 80 years or so when heart disease has grown exponentially, and then over here medicine is trying to just attack the lipids and give you a statin and a cholesterol lowering drug, which has never been shown to have much to do with this clotting response and heart disease, and they're totally missing the boat. And that's why heart disease continues to be the number one killer in the world despite all the latest drugs and latest procedures, because we're not really attacking the root of things. And then when I did those things, I was able to reverse plaque in my body, which they told me was impossible. So that's the story.
Really? How much plaque were you able to reduce?
So after the procedure they did during the heart attack, they did a heart cath and they went into my coronary arteries. There was a blockage in there. Whether or not that blockage caused a heart attack, I don't know that we can say that for sure. It could have been something totally different, which I'm happy to explain. But because of that procedure they did, they went into the artery in my groin. And after that procedure caused a change in blood flow dynamics down to my leg, and I developed plaque in my leg. So about 2 months after the heart attack, if I would just walk fast through the airport, I would get pain in my lower leg below the knee because I was getting restricted blood flow to it. So I wasn't getting...
The surgery caused this?
Yeah, the intervention that they did, because it changes blood flow dynamics down your leg. So when they seal up the artery after they do the heart cath procedure, they use this device called an angioseal. And the angioseal can alter the size of the blood vessel, but it also has this little piece that sticks on the inside of the blood vessel. And so as blood's flowing down that, now it's changing it, and it's kind of like, like when water flows past a rock in a river and it kind of swirls or eddies on the other side of it. It's kind of creating that. So now the blood's trying to flow past that and it's swirling or eddying, and it became stagnant in my thigh. And then it started to clot there and I developed plaque there. And so then I couldn't even walk fast without pain in my lower leg. So then, using light therapies and getting more infrared light and doing more grounding and setting my circadian rhythm and repairing a healing process over a year and a half, 2 years, I was able to completely reverse that plaque. It was a 75 to 99% blockage of plaque in my leg, and I completely reversed it. And then recently, I have testing of my coronary arteries. I have a CT angiogram that I had assessed via Clearly technology that shows that my coronary arteries are essentially clean. There's no plaque in them. There's a very small amount of plaque in the right coronary artery, but that was present at the time of the heart attack. It has not progressed, but where the stent is patent. There's no plaque anywhere else in my coronary arteries. So, and I've done all this. I've reversed plaque in my body, and kept plaque away from my coronary arteries with LDL cholesterol levels well above what they say is normal. They would say that that's the cause of it. You're going to develop that. And I'm type 1 diabetic, which predisposes me to heart disease because blood sugars are generally going to be elevated no matter how well I control it. They're more elevated than the person without type 1 diabetes. So despite all those things, I was able to reverse this, which suggests to me, and there's lots of literature to back this up, this disease is not about the lipids. It's not about the biochemistry of the blood. It's about the biophysics, structured water, infrared light, those types of things.
When did you find out about structured water in the first place?
Well, I knew about structured water before I had the heart attack because I'm just interested in health and science. And I came across the work of Dr. Gerald Pollack at the University of Washington. He's the one who has popularized structured water and made it most notable because he's talked about it the most and he wrote a book on it. But many scientists over the last 100 years have talked about how water in the body and in nature in various places can exist in this gel-like state. So basically what happens, we know that ice can happen with water, and we know that water can be water, like liquid water, but there's actually a phase in between those two that's more like a gel, and it forms in a very specific way when water holds energy and when it's next to a water-loving or hydrophilic surface. It actually orients itself into this gel-like state. So you can think of it like Jell-O, or the consistency of raw egg white, that kind of gel-like state. And most of the water in the body is in this state, which is why if I grab my forearm or my cheek, it kind of feels like a gel, It's not water. It's not like slushing around like a waterbed. It's in this gel-like state. But there is liquid water in the body too, like in the blood and in the lymphatic system and the cerebral spinal fluid. But this water in the blood, when it's next to the lining of the artery, which is a hydrophilic surface, it can become structured water. And all you have to do is go into PubMed and type in cell-free layer. And all these studies of all these different scientific groups come up, and they found this layer between the artery wall and the cells in the middle of the artery because there's this layer of gel that's protecting the lining of the artery. They didn't know what it was called at first. They just called it a cell-free layer because there's no red blood cells there. But Dr. Pollack has found, at least in animal models, that this does exist on the lining of arteries.
Yeah, so in every artery, there's like an exclusion zone of regular water, and there's like a structured water portion and then a regular one.
Yeah, so like liquid water, the blood is about half water. So that's what makes the blood a liquid. But on the lining, at any time water gets into if water holds energy, which is a unique property of water, it can hold energy. Anytime it holds energy and it gets next to a water-loving surface, like any surface in the body, it will become structured water. There'll be like this layer of structured water that forms on that surface. But then in the middle, like, around the outside, like the circumference of the artery or any tube, there's a layer of structured water, but in the middle, it's still liquid water. So the blood's still moving through there. And structured water has some very unique properties that explains blood flow and that explain decreasing coagulability of red blood cells and platelets, but also it protects the lining of the artery because of its exclusion properties. That's why they call it exclusion zone water, because it keeps things away from it. So when it's there on the lining of the artery, nothing's going to touch the lining of the artery. So it protects it.
So in the body, so over years, how do people get plaques built up on their vessel walls? Actually, this is one thing: do plaques build up on arterial walls or only venous walls, or vice versa?
We only find plaque on arteries, which suggests that there's something special about arteries. Because if it was cholesterol that causes plaque in arteries or in the blood vessels, then we would have, like, if cholesterol gets high and that causes plaque, we would see plaque everywhere in the body. We would see it in veins and in arteries and evenly distributed throughout the arteries, but we don't. We see it most commonly in the coronary arteries. We don't see it in veins at all. So how could it be the cholesterol if that's present everywhere in the blood, But the way that plaque develops, the only time we see plaque develop in a vein is when they use a vein for a bypass surgery. After the bypass surgery, when they put the vein in place where an artery, like to act like an artery, it develops plaque. So it's something about the pressure in the arteries that causes it to develop plaque. So how plaque develops, there's many different theories. The one that I think makes the most sense to me is that when you look at where plaque is, plaque doesn't develop on the inside lining of the artery. It develops inside the wall of the artery. There's 3 different layers in the artery wall, and it develops in the intima layer in the artery wall. And so the reason that happens is because, so remember, this is clotting tissue. So we're getting fibrotic clotting tissue in the artery wall. The reason that happens is because if there's something that causes the cells that line the inner lining of the artery, the endothelia, if something causes them to grow or proliferate or multiply, then those new cells that are growing, they need a blood supply too. And that blood supply does not come from the blood flowing through the artery itself. It comes from the arteries that supply the artery wall, which are called the vasa vasorum. So yes, the artery walls the cells in there need blood, and they get it from arteries that come around, small arteries that come around and supply the artery wall. And so when we get new cell formation that grows on the inside lining of the artery, those vasa vasorum blood cells have to grow inward to supply those new cells with blood. And when new blood vessels are growing inward, when they're growing or they're forming new, it's kind of, they're fenestrated. They have holes in them. It's kind of like you're building a house, but there's no windows or doors in it yet. And so that creates leakiness of blood. All right. So the blood leaks out. It leaks out right into the intima space, which is where plaque develops. And when it leaks out and it's not in a tube anymore, stagnant blood clots. And so we get this clotting material right in the intima wall, and that creates a growing of the intima wall. That's the original form of plaque, is right there. But it all starts when the cells that line the inner lining of the artery, when they start to grow. And what can cause them to grow? There's 2 things. One, damage to them. So if you don't have enough structured water there protecting them, then they can get damaged by things. And that can be various toxin exposures, or not being in the environments that create structured water, which again is outside in infrared light, or being in touch with the earth, getting electrons to your body in that way, builds structured water. So if you don't have that, then the damage can happen to the lining of the artery, creating a proliferative response, basically a healing response. That's what it is. You're creating new blood cells or new endothelial cells to heal. And then that creates the response there. The other thing that can create it is when we get blood flow that's too slow or too fast, because there's supposed to be this kind of Goldilocks amount of lateral pressure from the blood on the artery wall, like pushing out to it. And if it's too slow, then we don't get that pressure. Or if it's going way too fast, we're not getting the adequate pressure. And so
also too, what does the pressure wave of the pulse blood from the heart look like? It's repeating every hour 60 to 80 times. And how does that preferentially wear down parts of the wall, and depending on how stiff they are and their composition and all that stuff, I guess.
Well, so that's a different conversation. Like blood pressure is a different conversation. So is the pulse. Pulse is not caused by the forceful quote unquote pumping of a heart, because the heart is not really the mover of the blood. It's not a pressure propulsion pump. And there's tons and tons of research to suggest that. It's the most comprehensive, I talk about it in my book, but the most comprehensive book on that subject is The Heart and Circulation by Dr. Branko First. So that's a different thing. And the pulse is created by a change in pressure when valves open. It's not this forceful, pressure created by a heart contracting and forcefully moving blood. It's just a pressure change when valves open. But yeah, so when blood is moving too fast or too slow, the arteries want to maintain that lateral pressure. And when it's moving too fast or too slow, it can't do that. So it starts to grow cells inward, right? Which is the proliferation of cells. And then those cells have to be supplied with blood. So the vasa vasorum grow in, and when they grow, they leak blood, which explains why people there's plenty of studies that show that endurance, like marathoners, have higher rates of atherosclerosis. Why? Because they're running so much and their blood is moving so fast all the time. Not all the time, but way more than the average person's. And that predisposes them to plaque. So yeah.
What about if you did, every day you just lay down for 15 minutes and let's say meditated and you breathed and, to slow everything down and to give your body some time to chill out.
Yeah. So it all goes back to being in the right environment. Like humans never would have been inside away from sunlight and being in contact with the earth. So if you lay down and meditate and chill out, that's great, especially in the modern day, because our autonomic nervous systems are way ramped up way too much. But you would never have inadequate blood flow in that situation if you did it outside, because if you're outside under infrared light and in contact with the earth, you're building structured water, and structured water is what creates blood flow, especially in the periphery. And they've shown that in Dr. Pollack's lab. They stop the heart of a chick embryo and they shine infrared light on it. Then the heart is not moving anymore. It's not contracting anymore. And they shine infrared light on the chick embryo, and they saw an increase of blood flow 300%. So because you're building structured water, which creates an energy gradient that does the work of moving blood or moving fluid. You can do this with water too. You can put a hydrophilic tube in a vat of water, and they put infrared light on the water, and all of a sudden the water starts moving through the tube with no pump acting on it whatsoever. So this is a mechanism by which fluid moves, and it's the same mechanism by which, there's no pump that gets water from the roots of a tree up to the leaves, but it does it. How does it do it? Structured water. So yeah.
Okay. So what's are you creating any devices, or are you any protocols to help people create this structured water in themselves on a regular basis to heal?
Well, the most important, I coach people. That's what I do now. I coach people with heart disease and give them information and educate so they can make better informed health decisions. But the devices are already out there. Infrared saunas are the things that I would use, or red or infrared light panels. If you wanted an artificial source of those things, especially for winter when it's harder to be outside, depending on where you live, those are useful tools that we can get. And the research on infrared sauna and arterial health is amazing. It's so amazing that it baffles me that there's not infrared saunas in every cardiac rehab center in the world. There's not, because it's not profitable to do.
Oh, does it work?
Yeah, because they work. Yeah. So yeah, that's the device, but to use. But that's what I do, is I help coach people into understanding all these things so that they can change their environments and put their bodies in an environment that's more conducive to health in general, but specifically cardiovascular health, so they can change that path, just like I was able to do. You find out these things and you think about it in the context of human history and why it makes sense, and you do it, and then it has an impact, and it's just it's rewarding,
Excellent. Well, Stephen, what's the best way for people that has had or are on the way or been warned by their doctor? How do they start to get a handle on this? And, because the information you're sharing is, I'm sure, very unusual to people, and they're going to get pushback. They get to wonder and worry and all that. How can they get started to learn what's actually going on? What's the best path?
Well, my book is out there, Understanding the Heart, where I can make my book a lot longer now. I have a lot more information, but that's a great place to start. I explain structured water and its role in the vascular system, and I explain all about the research showing that cholesterol is not the cause of heart disease and all that stuff. So that's a good place to start. I also have my online, 12-week kind of heart health program that I'm running now. So people can find on my website the links to that and have a conversation with me if we want to talk about it. But there's lots of resources out there, not just mine. I mean, there's lots of people talking about this. People like Dave Feldman and David Diamond are outspoken about cholesterol and statins and things like that and how it's not the solution. But Dr. Pollack's work on structured water is fascinating, and it helps us explain so many things, not just the vascular system. So yeah, there's lots of resources out there. If we're looking at it from a cardiovascular perspective, that's what I've looked into the most. So, and then my social media, I'm always posting on my social media various things that, I'm trying to be educational and useful. So yeah.
Well, very good. Well, Steve, thanks so much for coming on the podcast and explaining. And your book's available on Amazon and everywhere people can get it.
Mm-hmm.
Okay. All right. Well, excellent. Well, again, thank you so much for coming on the podcast, and I appreciate it. And I encourage people to read your book and check it out, Understanding the Art, because as you share this info, I don't really understand it nearly as much as I thought I did. So
I didn't either. So
if you like this podcast, please click the link in the description to subscribe and review us on iTunes.
Thank you for listening to the Good Question Podcast. Please email support@thegoodquestionpodcast.com if you have any referrals to great guests for us to interview. Visit thegoodquestionpodcast.com to hear more interviews. And please help us spread the word by rating and reviewing us on Apple Podcasts, iTunes, Spotify, YouTube, or wherever you listen to this podcast.